Good afternoon, everybody. I have 12 o'clock. Let's go ahead and get started. Thank you, everyone, for taking the time out of your day to come join us. We are very fortunate today. We are going to have Katie Arrington. She is the Recovery and Resiliency Program Manager for Boulder County, Colorado. And I believe I've spelled that wrong, haven't I? So for those of you that have never attended before, the Wednesday webinar series was established as part of the Chemical Stockpile Emergency Preparedness Program to provide public information officers and other communication-related fields with virtual opportunities to address topic-specific issues in quick one-hour monthly webinars. KYEM plans to continue these valuable training efforts with monthly topics and featured speakers selected and scheduled accordingly to help provide attendees with real-world application to the following: planning and developing a process with clearly defined procedures to gather and provide accurate, timely, and accessible information on an event as it approaches or as it has occurred. So today's objectives. Today you're going to gain proven community engagement strategies from Colorado that you can adapt to strengthen counties and communities across Kentucky. Hopefully you're going to get an understanding of how under-promise and over-deliver builds trust in communities. Learn why repeating key messages in different formats helps people. Practice how to lead early listening sessions, and then spot stress and trauma in secondary responders. Our featured presenter today, Katie Arrington. As I said, she is the Recovery and Resiliency Program Manager for Boulder, Colorado. Katie has been working for Boulder County since 2013 when she was hired to help with flood recovery. She found her way into this work based on experiences as a child, experiencing the 1994 Northridge earthquake and regular wildfire risks. Katie has her MPH with a specialization in emergency preparedness from the University of California, Los Angeles. Katie's passion is in community engagement, examining racial equity issues during short and long-term recovery. She is a certified practitioner in the Courageous Conversations About Race protocol and is deeply committed to equity work both in disaster recovery and in Boulder County at large. Katie also has a passion for the mental health impacts of disasters on survivors and secondary responders, and recently completed her certification in forest and nature therapy to help those populations better reconnect to the land after a disaster. Katie lives in Lafayette, Colorado with her husband, two children, and dog, and loves biking on all the open space trails in her community. As a committed public servant, Katie is committed to serving the community through any future recovery efforts for many years to come. So please join me, give a virtual round of applause for Katie. Thank you so much for being here, Katie. I'm going to stop my share. You may say hello to everyone, and the screen is yours. Thanks for being here, Katie. I appreciate it.
Yeah, thanks so much. I'm happy to be here. Here we go. So I had a slide too, but we don't need to do that because Dave just did such a nice job introducing me. Thank you so much. Um, but I do have an introduction to what Boulder County has faced since 2010. So since 2010, we've had four major disasters: the 4 Mile Fire, devastating flooding events, COVID-19, which fell some on our division, and then the Marshall Fire in 2021. And then we've had smaller fires in between. The Marshall Fire burned about 1,000 homes, a little over 1,000 homes, and then it snowed the next day. So that was pretty devastating. And it burned homes that individuals really weren't prepared or ready for their homes to burn. It was we live in the wildland urban interface here in Boulder County. So the mountains are, if you're not familiar with our topography, the mountains are on our west. There's a lot of mountain communities that Boulder County is responsible for. But then there's towns and cities in the flatlands, and two of our towns were majorly impacted by that Marshall Fire, and not the mountain communities, which is where a lot of the preparedness and mitigation efforts have gone to. So since that 4 Mile Fire in 2010, Boulder County has been in a state of response or recovery pretty much entirely that whole time, except for 60 days. So our long-term recovery muscles are strong. We know how to do this, and I have been employed since 2013, really focused purely on community engagement, the soft skills, and the people side of what disaster recovery looks like. Learning objectives, these are the order. So listening sessions first, under promise, over deliver second, varied communication third, and then talking about stress and secondary responders four. The stress and secondary responders is not so much related to the overall community engagement topic. However, without addressing that issue, you are all are secondary responders. In some cases, your first responder. That's kind of a passion area for me. Okay, what does a listening session in Boulder County look like post disaster? It's a time for community to be in community with each other and with local government. It's a time for some basic initial information. It's where the start of the relationship between community and government begins. It's a space for government to answer questions and get back to community with questions we don't know. I have found in my decade plus of public service, that as county or city employees, we're not really good at saying no or I don't know. And this is really the place to say that because answering a question wrong at these early initial listening sessions pretty provides some long-term damage overall to your credibility and the way that the community trusts you after a disaster. I get more into that later. And in general, we recommend these to be in person. So in 2013, when we had floods, our listening sessions were all in person. In COVID, our town halls were all virtual. And then in the Marshall Fire, which kind of happened at the tail end of COVID lockdowns, it was a mix. So also in person is best, in my opinion. Even in this highly adapting world, there's a better bond between you and the residents and the impacted residents in person that doesn't happen virtually based on my experience. So, how do we start our listening sessions? So with the floods, the 2013 floods, we had several different mountain communities were impacted, and we actually knew neighborhood groups in all of those communities. So we set up listening sessions with all those communities really early on and went to them and heard their needs. The listening sessions, basically, we provide a little bit of information at the beginning. I mean, a rundown of a listening session is one facilitator, a couple note takers. We provide a little bit of information, the high level stuff. Is debris going to be removed? Is there any hazards? Is the event over? What kind of high level damage assessment has happened? And we have some, but we don't often have those subject matter experts talk at length unless a question is aimed at them. So, how do we connect with the community? Community listservs, government social media. For the Marshall Fire, we had an impacted neighborhood that we hadn't, and by we, I mean my division, the Recovery and Resiliency Division, that we haven't ever connected with before. So we reached out via Nextdoor to that neighborhood because I'm sure as PIOs you know that we can kind of target our messaging. And then we had our first community meeting post Marshall Fire in that neighborhood with the people that had signed up on Nextdoor, and then it expanded from there. And then sometimes, depending, we work with local nonprofits and community-based organizations. Um, we've held listening sessions everywhere. We've had listening sessions that later evolved into giant town halls. So we've had listening sessions at small churches that then merge into giant town halls where we need some of the bigger churches or school spaces. We have a bunch of community-based organizations and nonprofits in the area with a human services focus that have conference rooms. And so the listening sessions should not, if possible, and I say this as a place where we have resources for meeting space, should not be in government facilities, especially if it's like the EOC. A listening session at the EOC for residents that have survived a disaster is not the space where they will build trust with their local government. So really, the listening sessions should be in the community spaces that they're already familiar with being. I talked about this a little bit. I think it's really important to, when you're setting up a listening session, everybody's going to want to participate based on my everybody as public servants, we're helpers. I have found that pretty much everyone I work with at Boulder County is a helper, and they want to be there for the listening session. They want to provide information. They want to be a resource. And the listening sessions, when it's just the beginning listening sessions and not like informational sessions and not like town halls where we're working through a lot of programmatic details, outlining complex recovery actions. It's not a place for a lot of information. It's a place for high level, limited information. It's also not a place for any sort of political agenda. I know that that depends on your jurisdiction and the event, and that's dependent here too. But wherever possible, when we host listening sessions in the community, if elected officials want to come, they are welcome to come in a non-speaking way, but in a supportive way. We acknowledge that they're there. We thank them for being there, but there's no sort of political basis for them being there. There's no pressure. Residents are able to not listen to future campaigning or whatever it is that elected official has to talk about that day. It's also not a place to provide unconfirmed details. If there's questions that can't be answered, just say that we can't answer that question. It's much better than giving a half answer or a not true answer or an answer that proves to be not true later. Because those initial sessions kind of become gospel to the residents. Anything we said after the Marshall Fire in that first kind of 60 days, anything any of the funding partners said, anything any of the community partners said, our residents held us to that. And I wish we had proceeded with more caution with what we were saying. It's super hard to do because there's going to be a lot of pressure from your residents to answer questions that they need answered, and some will just not be answerable. So, why listening session? It's the starting place for trust. It's also a starting place for trusted leaders and cultural brokers to emerge. We use the term cultural broker here pretty widely, but in case you guys don't use that term in Kentucky, it's basically just a neighborhood, a resident, a trusted community member who has connection to lots of different community people. So it's the person who you would need to call. It's like the PTA president for a school, but in the community member. And all community members have cultural brokers, whether or not they have been identified one or they identify themselves as one. And so finding those trusted individuals early on through the listening sessions is really important. They'll be your communication kind of conduits going forward. This may also be the first point of contact your residents may have ever had with local government. Most residents don't most residents don't ever think about what local government does. In my experience, had very much interaction with the exception of DMV and registration and tax issues. So this is a place where trust can be built forever or not. So I think it's really important to understand that we all know what we do really well. We know the differences between jurisdictions. The residents don't know, and the residents, frankly, maybe don't care. In Boulder County, we have two government organizations. One is Boulder County, which is responsible for all of an unincorporated Boulder County. And then we also have the City of Boulder, which is a wholly different government agency with different jurisdictions, different rules, different employees. When residents come to me with a problem that I then have to route to the City of Boulder, it doesn't matter to, they don't know that I'm a different employee than the City of Boulder employees. And it's better for me to navigate that system for them than them to navigate it themselves and get frustrated with the bureaucracy about it. I talked about this a little bit with the listening sessions about why under promise, over deliver. The first public statements that are made post disaster will be the absolute truth through your whole recovery. No matter how much you say we spoke wrong then, that information is updated now, you will be held to those early comments, especially if there are statements about funding, statements about how long recovery efforts are going to take, statements about the state of recovery or what caused the incident. Promises made early on will be referred to often. This is a hard place for local government to be because sometimes the promises made early on are made by our state officials or our federal officials who are coming in with earnest desire to help. But there will be some battling of, oh, well, your governor, Governor Polis and our promised this. Why isn't this happening? So there's, you know, if at all possible, if you can control the messaging at least at the local level and not make promises, that helps not have too many promises out there. Again, there's going to be continued pressure to answer questions and move progress forward before you're ready. And there will also be desperation, legitimate desperation on the part of residents and community members of all sorts to start programs before they are ready to go. It is more harmful, in my experience, having just gone through this, starting a program before it is ready to go than holding the date on the program. And lost trust is almost impossible to recover. Typo there for me too. Um, Again, you lose the trust, then you're just uphill battle the whole time recovering it. I'm going to talk about our kind of case study in over-promising and under-delivering and why the opposite really should be a priority. So post-Marshall Fire, again, we had about 1,000 homes destroyed. So homeowners, renters, we had homes in our most wealthy areas of the county destroyed, and we had whole neighborhoods in our only kind of middle to low income neighborhoods destroyed. So a wide range of homeowners were impacted. There was a desire to set up a case management system inside of 6 months. If you don't know, normal time frame for case management after a disaster is a year. We had the funding early on, the program design happened quickly. We had a contractor. The program started at 7 months. Demand was way higher than anticipated, and trust was lost. Why? What went wrong here? There were several funding partners involved in this program, and fundamentally, and I say this, let these lessons are learned because I was the program manager for all of this. So these are actually my lessons learned the hard way. So we did not discuss different guiding principles for how case management for happen between the funders. That was a fundamental flaw because one organization was centering equity and equitable recovery, and one was centering equality. And those are fundamentally very different things. And there isn't a right or wrong way there, but one organization was approaching it from a totally different lens of the other major programmatic kind of stopping points that happened as a result of that mismatch in guiding principles. So in this case, if I were to do it again between two organizations that had different guiding principles, I'd at least have us come to agreement with what the guiding principles for this particular program would be, so that everybody was in agreement there. We set a date to open at once we had everything ready to go, we set a date that we'd open at 7 months post disaster, and we adhered to that date despite there being evidence we were not ready to open at that date. The public pressure was high, the elected official pressure high, the state pressure was high to open by that frankly relatively arbitrary date. And we did it. And that was a huge mistake to open early before. We could have opened some triaging, we could have prioritized cases better. And one of the funders really wanted us to serve everybody who had a need without an ability to triage. And if I was going to run a program like this again, that just doesn't fundamentally make sense to have any sort of disaster funding or case management system that doesn't involve any sort of triage, because there just are people with higher needs than others. There are people who are renters and literally have nowhere to go and no additional resources. And then there's people who did lose their home and do have additional resources, and to be or answering their calls at the same time without an ability to triage sort of handcuffed our case managers. But because we said we would serve everyone, nobody would be prioritized over other people. It was kind of a first come, first serve thing. It was really hard to backtrack into prioritization. So this is again the uh, we overpromised. And then we were battling images and perception over our backlog, our ability to case manage the whole time, the whole 18 months that program ran. My basic job was kind of spin control and answering media and answering funders and answering government officials about why things were not working well. And I fundamentally believe if we had just started 4 to 6 weeks later, everything would have functioned much, much better. So this is like a symptom of public pressure, overpromising, need. We did the best. We did the best we could with the information we had. Our population needed the collective trauma of losing 1,000 homes in one community was much greater than anyone had expected or thought about. And people who are normally well resourced emotionally and physically and financially collapsed under the pressure here. Okay, repetitive and buried. This is sort of my quickest one. A lot of you are PIOs in the room. A lot of you know this. This is why social media exists. But how do we communicate with disaster survivors? We've been doing basically all of this the whole time I've been at the county in some variation. Weekly newsletters. Originally in 2013, they were print newsletters that we had. Now they're email newsletters with a listserv, kind of just what's the state of recovery at that moment. Even if we didn't have new information, we would just send out the same newsletter again. Press release with the information that's in the newsletters, basically saying yes to media interviews, especially more radio ones where they're longer and we can go into details about events. Because I definitely know we had residents that never heard or processed a thing we said that was written, but then would follow up with me because they heard me on some of our radio interviews, town halls and listening session. The difference between a town hall and a listening session, in my perception, is listening session is about getting information and town halls are about giving information. And both are really critically important. I am sure this is not surprising to you, but it continues to be surprising to me. Um, my my supervisor and I were continually surprised through all of the events we worked together about how 6 months after program deadlines passed, we'd finally get someone who was like, "Oh, I have been, my mom died right after the disaster. I haven't had time to process anything, and now I need access to those services because otherwise I can't rebuild my house." So the trauma of, and some of the things I'll talk about with secondary trauma in a minute, relates very clearly to primary trauma, and people that experience the trauma is the, you don't know when a disaster survivor is going to hear your message. So it might, they might hear it the third time in a newsletter. They might hear it the fifth time it's said by a politician. You'll never get bad feedback for repeating information. There's only usually gratitude for repetitive information. I have never been told I've already heard that. And I've been doing this for the county for almost 13 years. Okay. Our best practices are to provide a trusted person in government to connect with. We are lucky to be Um, we are unlucky in that we've had so many disasters that we now have a permanent recovery function, and I am lucky to fill that role to be that trusted person in government to connect with. So that means an actual face, phone number, and email address. I understand that that's a privileged position for our county and that that might not be possible because there's not a person that could field all those calls. But for me, I answer residents within 48 hours. I find requested information when asked rather than passing that along to another person. Um, Information should always go to cultural brokers too. Another really critically important thing is that when you have so many partners working on recovery efforts, any place you can have coordinated messaging or coordinated deadlines just is positive for everyone. Some partner agencies and you all may not work well together, and that may not be an option. But when it is an option, the effort, the extra effort to provide that is well worth the investment. Okay, last section. Secondary responders. Probably most of you, some of you are first responders too, but some of you might be long term. For us, we've seen secondary responders with case managers, recovery managers and staff, the Office of Emergency Management staff that work on it long term, disaster assistance center staff, government officials who may not actually be dealing with residents but are dealing with the collective trauma of residents, planning staff. So, our community planning and permitting department sees a lot of stories and trauma and non impacted residents who are helping. Um, Secondary traumatic stress, the emotional duress that one suffers when hearing about the firsthand trauma of another individual. So, I think if any of you, I would imagine most of you have been in some situation where you have suffered secondhand trauma, whether that's personal on a smaller scale or in your community or with your state. Um, the symptoms we are lowered concentration and focus, apathy, preoccupation with the trauma, rigid thinking, so really being unable to bend with the way you're answering questions. Some emotional responses, guilt, anger, numbness, and sadness. How does that affect the person, like outside of work? Withdrawal, sleep disturbance, appetite, hypervigilance. How does that physically impaired immune system, increased severity of medical concerns, difficulty breathing, increased heart rate? What I say often here is I share a personal experience is that post-COVID, going into the Marshall Fire, there was no break. And I was a COVID secondary responder, helping with vaccine clinics and helping with internal operations for the county. And then we went straight into the Marshall Fire. And then I suffered a concussion because my I was not present in my surroundings and had an accident where I suffered a concussion and immediately needed 2 weeks of FMLA, like doctor mandated leave, partially because emotional, like just check out, and partially because of the concussion. And if I had a better awareness of these, or someone supervising me had had a better awareness of these, I may not have had the concussion. I may not have needed that long-term FMLA break, and I might have been able to use coping skills in the middle. I I talk to residents who have suffered very high trauma on a regular basis. And I'm not a therapist. I was not given skills to kind of set up guardrails and how to deal with that. And my guess is most of you were not either. So I see this more and more as disasters get longer and bigger and harder. Um, so that's why I'm bringing it up in this presentation. How do we as a county address? We have group debriefs for internal staff, talking about hard cases, but also just talking about regular logistics. We have hosted resiliency and secondary trauma training for all secondary responders. So we invite all our local jurisdictions to participate in this kind of 4 hour secondary trauma training. In the Marshall Fire, there was grant funding from a major donor to provide individual counseling sessions for primary responders, impacted residents, and secondary responders. That was outside of insurance and outside of anything else. So there was nobody knew you were accessing those resources. There was no stigma attached because you could actually just have your individual therapy. There was not data tracking with, I mean, there was some high level data tracking, but that was a heavily used resource. And I'm so glad we had a donor that prioritized that. EMDR is a way to proven way to treat traumatic situations in individuals. We started working on nature therapy programming, and then also after our disaster assistance center closed at the Marshall Fire, everyone who had worked at least 4 shifts at the disaster assistance center had to take a forced consecutive 3-day break the following month where they were not allowed to check into work at all. And those days were sort of, I mean, I'm sure some people skirted around it as we do, but pretty non-negotiable. I wanted to provide a resource. So Lida Hill The Lida Hill Institute is an institute out of one of the universities in Colorado here, and they provided our secondary trauma training for our secondary and primary responders. And they now have a online toolkit called the Greater Resilience Information Toolkit, and the link is there. And a lot of the information in the toolkit is what we got through the training we had. So I didn't want to offer that you should do more for your employees without actually giving you a resource, and that's free. And they're really great. And I actually think if you wanted them to do an online training for a certain population of people, they can. I just have had really good experience with them, so that's just kind of a personal uh, pitch for them, or just also the fact that they have this free resource that seems to be really useful. I just discovered it recently, so I'm still figuring it out. And then my email address, cell phone number, again, this is part of my job, to kind of connect with other jurisdictions. We fortunately, unfortunately, have a lot of experience in disaster recovery. And there's no sense in you all having to reinvent the wheel in a situation that we may already have gone through. So if there's a question you want to ask that seems very specific to you, or you don't want to ask it in the group, just seriously follow up with me, and I always respond.
Excellent. Thank you, Katie. That was great. That was great. If anybody has any questions, you may put them into chat now, or if you would like, you may unmute yourself and ask Katie yourself. That would be fine. We do have one. Emily Martin asks, you had mentioned Nextdoor early on. How do you all utilize the app in these situations?
So we have government next door accounts, which our public information officer set up for me. So I don't know how that happened. But then when I go into next door as Katie Arrington, Recovery and Resiliency Manager, rather than Katie Arrington, resident, so I have to get out of my resident account. I'm able to actually like uh pick the areas I want to message. So I knew in the case of the Marshall Fire, the kind of geographical range that was impacted. And I like just messaged those groups instead of our normal government messaging, which messages like the whole county.
Excellent. Yes, Emily, I love Nextdoor. I use Nextdoor a lot. I have a statewide account, so I can do both county, I can do local communities. I've actually worked with Nextdoor to create communities. So I created a CSEP community, which is 10 counties around Madison County, and I've created communities that match our National Weather Service. So Nextdoor is great. If you want to learn more, email me and I will get you connected with some resources. But it's a great app. I recommend it to all the communities. Thank you so much. Uh, let's see. A follow-up question. For your listening sessions, do you have an agenda? And what does that look like? What's the time frame?
Yeah. Um, so I would say, depending on the community size, 90 minutes in the evening after work seems to be the biggest kind of way we catch the most amount of people. Agenda usually is kind of welcomed by whoever is facilitating, which is often me. So talk about my role, what my division does, how we can communicate, give. So in our major flood and fire, there was a lot of issues with debris management. So the agenda early on involved how the debris management process was going to work. So it's more or less 90 minutes, 20 to 30 of us talking at them and 4 minutes of them asking us questions. So that's why I try to have subject matter experts in the room because my my expertise is shallow in many areas. It's wide, but it's pretty shallow, so I can't answer building permitting questions. So having them in the room, but not having them speak at the beginning. But basically, the agenda is basically 1/3 us talking, 2/3 them talking and answering questions. And then we always provide we track all the questions asked and all the answers. And if questions are asked and we can't answer them in the listening session, that is followed up with an email. So everybody on the listening session signs in, we have their contact information, and we follow up the listening session with all the questions and all the answers that were provided then and the follow-up answers.
Excellent. Thank you. That just answered a couple of my questions because I was curious about who would lead that, and then I was curious about how you handled the answers to those questions. So that's great. And Emily has one last one she says with a big smile. Could you talk a little more bit more about your nature therapy pilot?
Yeah, so um that in 60 seconds that I can talk about. Basically, forest and nature therapy is starting, it's been studied in Japan for 45 plus years as an actual physical way to reduce stress and trauma in just overall stress, but also in traumatic instances. It's starting to be piloted in the US, especially with people suffering from PTSD after war, but then also with people who have survived a disaster in healing with the land, but also processing some of their trauma. So it's twofold. It's about processing the trauma from the land and then healing with the land. I recently became certified. We have two or three other uh, nature therapy government employees in various jurisdictions in the county. So we are just the certification for it is pretty intense and is a year long. So we are just starting to roll out that pilot. So it's a little bit too far after the Marshall Fire to understand the impacts specifically for this event. But we're hoping that for future events, we will have it as a resource or just for ongoing resiliency, community resiliency, and mental health as a resource. And I could talk about it for hours. So,
Excellent. Great questions, Emily. I have a question, but before I do, I want to highlight a couple of things you said because I'm a PIO and I love what you said. Um, Answering a wrong answer is much more detrimental than saying I don't know. I teach this in my L105 Public Information Basics class. It's okay to say I don't know. Follow that up with I will get you the answer, and this is how you will get that answer. I love that. Thank you so much. Don't start a program before it's ready. I love that. I've seen many programs myself rolled out way too early. They weren't ready to handle what was going to be expected of them, and it took forever to recover that and start the road back. So excellent. You mentioned radio interviews. Um, we have a lot of local radio stations that are very powerful. So especially for the local communities, the counties in Kentucky, we try to utilize that more often with like PSAs, but PSAs, interviews, whatever the case may be, you can get to your community really nicely, really effectively. The radio stations are great at working with you to get information out about resources and everything that's available post disaster. So I love that you
and
mentioned
they're a
that.
little bit different than like camera media, which sometimes can be a little bit gotcha based, right? Like depending, and I under and when your face is on and it's a little bit more nerve-wracking. But I have never been on a radio interview that felt like I was being asked gotcha questions. It was more like curiosity and really wanting to be the resource. So like I find them much less pressure and much more valuable than sort of the on-camera, national news media. So
Yep.
yes.
Absolutely, totally agree with that. And one more, and then I'll get you to my question. You mentioned coordinating message. As a PIO, I preach the GIST, Joint Information System. I encourage everyone, build your networks, talk to each other, because so often I've seen it where one person is saying one thing, somebody else is saying something different. They thought they were saying the same thing, but they really, really weren't. It is important to build that joint information system so everybody is saying the same thing to everyone. Thank you. So now to my question. Sorry to I'll get off my soapbox as a PIO there. Um, do you have any like boilerplate language on the expectations or announcing one of these listening sessions? Because that seemed to me would be a critical point of letting them know that this isn't, we're not going to have all these answers. We're not going to have maybe all of the government leaders that you're expecting there. That's not the point of this message or this meeting. And how do you get that out to them so that they know that when you finally bring them together and have the meeting?
Yes, I'm sure. Yes, we do have boilerplate, and I'm sure I should probably have it ready on hand so I can dig it up for you all. But yeah, so that's exact that. So um, depending on the event, it's different. With the flooding in 2013, much smaller scale, we were more connected to those communities. We did individual emails to the community leaders and let them kind of spread the word. So we were trusted partner. We were already a developed trusted partner within those mountain communities. So we let them spread the word for us. So we just did individual one-on-one emails and like kind of like the phone free messaging help with Marshall Fire. We just used every resource we could because Marshall Fire was so big in scope. There were so many jurisdictions. Everybody was scattered because we already had a housing crunch, and then we lost 1,000 homes, which is a fair percentage, fairly large percentage of our homes. So that was where like the next door posts came, the Instagram posts came, depending on the size of the listening sessions. Actually, this was probably more with our town halls. With our town halls, we did press releases about them. With the listening sessions at individual community level, we did not do press releases. Also, listening sessions are not media friendly places, and we have told the media that they are uninvited to come. Where with our town halls, which are more information pushing, we do invite media to come. So that's also something I think is important, that those listening sessions are a space where residents are not going to be asked media questions, which I didn't bring up before.
Excellent, excellent. Thank you. All right. Does anybody else have any questions before we let Katie go? I do have a couple of quick announcements. So if you have a question, again, feel free, unmute yourself and ask her directly or put it into the chat. In the meantime, Katie, I'm going to take the screen back and
Sounds good.
share it. So you all have my contact information. Feel free to contact me anytime. Questions, suggestions for better webinars, topics, whatever you want. I've got the links here. I am going to be moving our recordings to the KYEM YouTube channel. I'll make sure you get a direct link to that. Our upcoming schedule. I have a couple of good ideas for March and April that I'm continuing to work on. But I do have the February webinar scheduled. I hope to have registration open for that later today, if not tomorrow. The weather's kind of throwing us into a little bit of a fit. We've got a lot of things going on right here, so I won't make promise on that, but it will be open very soon. And it's the webinar title is called Overcoming Resistance, Equipping Leaders and PIOs for Crisis Communication Success. So in communities with limited resources and evolving emergency structures, PIOs face the critical challenge of preparing elected officials who may lack crisis training and time. In this interactive session, Melissa Agnes explores the invisible resistance that hinders effective communication in high-stakes moments, from leaders reluctant to train to those unprepared to meet their communities with empathy and clarity in moments of crisis. Together, you'll examine what it takes to build readiness into your culture, even when time is tight and buy-in is elusive. I have attended several webinars with Melissa. She's a really great speaker, world renowned, and I think you'll enjoy it. So I hope that you'll join us for that. Here is a little bit more. Again, the QR code for registration, I hope will be open later today. And with that, if there are no more questions, I see nothing in chat. Katie, again, I want to thank you. It was a pleasure. It was a really good webinar. I learned a lot. Thank you, everyone. Thanks for joining us. Have a great rest of your day. Be safe, be warm.